this is Baxter. He is about 14 years old, or young I should say. He thinks he's still a pup. He has been coming to me for acupuncture for the last 5 or 6 months. It's become a routine for him and he tolerates it quite well. So we're starting to work on him already, because if I don't with Baxter, he starts getting a bit impatient. So what we're doing is treating arthritis of the hips with Baxter. So the first needle that I place with him is up here, because it's an area that he's used to and it kind of just warns him what's coming. Acupuncture is a really, really safe thing to do on old arthritic dogs. We're not giving them drugs. We're not, so it's not a painful procedure. A lot of people worry that we're hurting their dog. You can see that Baxter's starting to relax now a little bit, and he generally will lie down after a few more needles. It's really safe. So what acupuncture is it's inserting a solid needle to relieve pain, basically. So the acupuncture that I'm carrying out here, I did my training in the Western acupuncture. So there's 2 types of acupuncture. There's our traditional Chinese medicine, and then there's our Western approach. So the Western approach is where you do a full assessment on the dog, you find out where their pain is, and you're working on the neurological pain system. The traditional Chinese medicine is kind of more of a holistic approach where you use herbs, and it's a segmental approach as well. So it's all to do with inserting a needle in one area to try and help another area. I'm not trained in that, I'm trained in the Western approach. So a main question that people ask is, how does it work? So in our body we have 2 types of pain fibers. We have a fast pain fiber and we also have a slow pain fiber. So the fast pain fiber is what releases lots of endorphins and makes us feel a lot better about ourselves. And whereas the slow one is a chronic pain where pain has been going on for a long time. So what acupuncture does is it tricks the body into thinking that we're dealing with a fast pain, not a chronic pain. So fast pain is where something hot, put your hand down, ow, move your hand away. It doesn't necessarily cause you pain and suffering. It's a quick response. So what we're doing is we're doing that so that we get a release of endorphins. It has the physical effect of working on actual myofascial pain points, pain triggers. So that's by assessing the dog. I know that back in these hindquarters here, he has a lot of myofascial pain because he's carrying his weight back there from his sore hips, and also up in his shoulders and his neck here, he gets a lot of myofascial pain. So you can put the needle directly in that to relieve it. Come back, you're not done yet. So I try to leave the needles in for about 10 or 15 minutes per dog. This all depends on the dog's tolerance. Baxter, when he first started off, we got about 3 minutes and he shook himself and that was the end of it. Now he completely settles down. He's lying on a hot pad here, and his 2 little legs are relaxed now, but if I give him any chance at all, he'd try and run away, wouldn't you? Yeah. That licking is all signs of endorphins being released, of him relaxing and endorphins being released. An initial session is about half an hour, so that's where I'm going to pain assess the dog and find out their areas. And then after that, a follow-up consult, which this is what Baxter gets. He comes in every fortnight, and it takes about 15-20 minutes then, by the time the needles are placed and out and they go home. Like you can see now, like every dog is different and every dog has their limit. Like Baxter doesn't sit still for very long, like he has a limit. But we've slowly been working up with that and he's getting better and better. Some dogs will tolerate and lie here they'd be quite happy to lie for half an hour. Baxter's a naturally just a very active little thing. Now he's settling again. So not every dog will respond. Most dogs respond really, really well. You need to do an initial kind of course of 4 sessions once a week to find out if your dog is going to respond. It's not an instant response. He's fine every fortnight. There's another girl that's coming in as well, but she needs to come in every week. Her owners find that she gets like maybe 7 days out of it and that's it. So what we can do is we can stimulate the needle a tiny bit by moving it around. Or sometimes what people do is electroacupuncture, where you attach basically a little battery to it and it causes vibrations. So if a dog is getting to the stage where you're not getting a response out of it anymore, you can. But I find even just by stimulating the needle, so I'll do that if I feel that they're getting to the end of their patience with it. And then we just remove the needles. So day 1 after acupuncture, the dog can be a little bit sorer than normal, just because you've put needles into the sore areas and stimulating those fast pain fibers. They can be sorer than normal, but by day 2 then they're back to themselves. So acupuncture can be used for many different reasons. We find that the response to osteoarthritis in older dogs, chronic pain, we get the best response, but it can be used on any age, and cats are brilliant responders as well. Cats do really well with acupuncture. So it can be any age. It all depends on the type of arthritis they have. So obviously if it's a young dog and their cartilage has deformities in it and they need to go for surgery, acupuncture is not going to do a huge amount for it. But if it's an older dog that's suffering a little bit with chronic pain, they'll respond quite well. So I'm going to tell him, Baxter, you're all done now. You all done? Yes? You ready to go? Come on, so. You ready to go? Yes, come on. Are you ready? Yeah. Come on. Come here, we put your knee down. Come on.